This is a unique presentation, so I thought I would film treatment of her second rib. Would you be able to point where you feel symptoms? So you're pointing right below the clavicle towards your foot.
Mm-hmm.
Okay. What does it feel like there?
Feels like a broken bone.
Like a broken bone? Tell me how it impacts
you. It just feels like it's jabbing, and it makes a little bit hard to breathe and hard to exercise. Like it feels very restricted there. Like
okay.
Uncomfortable.
Alrighty. Can you identify that restriction? I mean, can you feel where it's restricted, or?
Just in here.
Okay. Alrighty. So can I palpate that area?
Yes, please.
Okay. So I think you're pointing more to the second rib.
Mm-hmm.
The first rib is very short, and it does come just slightly beneath towards the foot, but also behind the clavicle.
Mm-hmm.
Okay, but you're pointing more lateral. So I think we're dealing with the second rib. I'm on what feels like a bony rib on each side, and I'm doing spring testing, and I'm doing spring testing here, and that moves. And I believe that to be your third segment, your third rib. Mm-hmm. And now we come on this one, and I can feel and see that it's more prominent, this rib segment here. Mm-hmm. Now I'm more towards the ceiling. Okay, you're laying on your back, is towards the ceiling. So I'm just going to spring this side, and then no give there. Do you feel the difference?
Yep, totally.
I'm even putting more force. Can you tell?
Yep.
Yeah, and there's no spring mobility there. Okay. So let's have you lie on your stomach. Well, I don't have a videographer with me. I am the videographer of the day. My wife had retired and she was helping me, and then she went back to work. Yeah, and then we lost our student employee. Okay, so I believe that I'm on the third rib here. Okay, and I can get spring mobility there. I'm just inside of the scapular border here. And now I come up one, and it's deeper now. On your left, that is deeper. And I'm going to try and spring it, and there's no spring mobility on that side. On your right side, I can easily spring. The motion goes through that joint and goes beyond it. Okay? First rib should be right around here. Okay, and I can get spring mobility there. So I submit this is an unusual twisting injury. I just don't see the rib go medially in terms of second, third, fourth rib. Very rarely on the first rib do I see it get stuck medially, but quite often laterally. You know, our arms are in front of us, we're hunched over computers, we use our arms, our hands. So that tends to bring ribs outward, but this is an exception to that. So there's a slight lateral angulation of that rib. I'm going to contact that rib. I'm going to push it towards the floor to get some gapping of the joint, however minute that might be. And then I'm going to induce a lateral force, okay? I'm going to do that for 2 minutes. I want this to be a once and done. So I call it a correction, not an adjustment that needs repeat treatment. My experience is that this should be a one-time fix. All right, I'll stop filming and I'll treat it.